I'm Dr. Khan from Harley Street Skin Clinic, and today I'd like to talk a little bit about skin. Now, the skin is an incredible organ. It's one of the biggest organs of our bodies, and it has multiple functions. It's involved with thermoregulation, keeping our temperature right, maintaining the internal environment, and protecting us from external assaults like UV damage, pollution, trauma. So the skin is really important. And because it's under threat and under attack, most of the time it's turning over on a regular basis. And for healthy skin turnover, what we need to do is to be able to look after it properly with the right skincare. The skin has a natural turnover. Because it's being assaulted, the surface of the skin is keratinized. In other words, we've got keratin within the dead skin layer, and that acts as a protective layer. Now, there is a natural turnover of the skin. The skin normally turns over about 4 to 6 weeks. And as we get older, that turnover starts to slow down, which means that the dead skin cells pile up a little bit more. In doing so, it makes our skin look a little more dull, a little lacklustre, and that luminescence disappears. So it's really important to cleanse our skin on a regular basis, to consider exfoliation, so we can keep that dead skin there turning over, so we see healthy, better, more luminescent skin. When looking after our skins, it's important to understand the natural skin cycle. Skin turns over in about 28 to 40 days, which means that there are new cells being produced and they start to move to the surface and then they exfoliate. It's really important to understand that things that affect regular cellular turnover are going to affect the turnover of the skin. Things like skin damage through excessive sunlight exposure damages the DNA and affects the natural replication of skin cells. Things like poor nutrition. If we're not eating properly, we're not providing the building blocks for the skin, and that includes amino acids, the energy with the macronutrients and the micronutrients, then our skin cycle will slow down. Also, if we're under a great deal of stress, that will also slow the skin cycle down. And that stress might be due to psychological stress or physical stress, which might be through ill health or through trauma. When the skin isn't turning over properly, the dead skin cells actually stay for longer and build up. So gentle exfoliation is really important. In stressed skin, we don't want to use harsh exfoliants. So what we want to do is gentle exfoliation, regular cleansing. We want to support the skin as well, in that we want to give it the right nutrients. Now that is internally with a good diet, with good rest, plenty of sleep, with minimizing the stress and maybe doing some thoughtfulness and some meditation to help reduce our stress levels. And also through giving the right protectants and nutrients with our skin care. When the skin isn't working properly, we're not producing enough hyaluronic acid within the skin, and this reduces the hydration of the skin. It looks more wrinkly, it looks older. Now, in order to hydrate the skin properly, we need to again support it internally with drinking plenty of water, eating good healthy foods, supporting the production of collagen and of hyaluronic acid. And externally, we can protect the skin by adding hyaluronic acid, by adding ceramides, and by adding nutrients during the day. During the day, we can support cellular function of the skin because it's active, it's doing its job. But the skin regenerates at night when we're sleeping. So to rebuild skin, it's important to understand that we need a good night's sleep. So do what you can to get a good night's sleep. Disconnect from electronic devices. Don't sit on your phone in bed, because that will delay the time it takes for you to get off to sleep, and certainly to get into that regenerative sleep, which is a deep sleep. So sleep is important, but also ensuring that we've got good nutrition internally to help build the skin right back again. And the products that we use at night are peptides, which stimulate cellular regeneration, and retinols, which help to support that regenerative process and helps the turnover of the skin. Having supported the skin in every way that we can, through diet, through exercise, through great skin care and understanding how skin works, the next level to improve the quality of the skin and to regenerate it is to think about in-clinic treatments. And these will include very basic treatments where we're exfoliating using machines and facials. We can use microneedling to further stimulate regeneration by causing micro injuries to the skin. And we can support this by using things like exosomes and peptides and polynucleotides in order to support that healing process and push it more towards the regenerative side. Deeper treatments for older, more tired skins are important as well. And we can start looking at things like Morpheus 8, which reaches deeper and delivers energy into the dermis. And that can be supported again with exosomes, PRP and growth factors. And that helps with the regeneration and with the renewal of skin into a much younger looking skin. More and more people are coming in and asking for smoother glowing skin and even glass skin, which is a trend that's come over from South Korea. Now, in order to achieve this, what we do have to realize is that this isn't achievable without a treatment. It's not the natural state of the skin to look like glass skin. So how do we achieve this? Well, doing all the supportive treatments, the skin care, the good nutrition, the treatments that we do to stimulate collagen and the deeper regeneration, but then we've got to think about how we can achieve the polish on the surface of the skin. Now, a glowing skin is a skin that not just has a good hydration and good skin turnover, but also has a good blood supply. So that the blood vessels are not overdilated, they're not inflamed, so we haven't got that redness, but the blood supply is supporting the actual appearance of the skin. Also on the surface of the skin, we need to polish it, and this can be done with non-ablative lasers. So lasers that just put energy in and just take that dead skin layer off and give that smooth skin appearance. When you combine that with excellent skincare and hydration from the surface, then you can get tighter pores, you can get the appearance of that glow and that glass skin. Once we've achieved our ideal skin, which is glowing, looking younger, well hydrated, and we look the best we can, we should be thinking about how we maintain that look. And that's done through maintenance. So keeping those good habits going, good nutrition, avoid excessive alcohol, not smoking and damaging the skin, avoiding excessive sunlight exposure, and protecting the skin with good products during the day, with antioxidants, vitamin C, niacinamide, and in the evening feeding the skin with peptides and with retinol, but also using sun protection during the day, especially during the hours when the sun is really high in the sky. When we're talking about skin, it's really important to understand that general living will cause the skin to become dull. We get exhaustion of the skin, we get damaged by the environment through exposure to poor diet, poor food content, free radicals, the way we live, alcohol, smoking, all of those things will cause our skins to look dull and slow. What we want to understand is that how we can help our skin is to clean up our lifestyles, think about feeding and protecting the skin during the day with good products, good skincare and sun protection, and feeding ourselves well, and in the evenings how we can support regeneration, and we do that with good sleep and with feeding the skin with peptides and retinol.